Okay, so this discussion is going to look at the idea behind rationale and considerations for training special populations. So as we're going to be talking about throughout this semester, we're going to be basically discussing how we could apply fitness and exercise recommendations for individuals who, as we would consider based upon special populations who have real specific concerns that need to be kind of looked at when you're designing physical activity routines for these individuals. So in looking at when we're saying special populations, what do we mean by that? So special populations are basically individuals with chronic disease or disability, as well as groups that differ from the overall population with regard to age or specific conditions related to the gender. For instance, with age, we look at the extreme ends. We look at, youth versus the elderly. Okay, and then in looking at, as I'm giving the example on here, looking at, for instance, special considerations when you're looking at females, at physically active females. So despite the physical and psychological benefit of exercise, exercise participation is not always a given for all people. And we know that there's inherent benefits to remaining physically active. Because of limitations or characteristics, certain groups of individuals or special populations, they require altered exercise programming supervised by specially trained exercise professionals. So again, for individuals who are exercise professionals, getting added education in these special populations could be really important and can really assist these individuals with, particularly individuals who have to manage some type of disease. And many individuals who'd fall into this category just want to exercise for the same reasons everybody else does. Okay, so for an individual who maybe doesn't fall under the classification of special populations, think of the reason why they would want to exercise. Better health, feeling better, what have you. Well, individuals in these groups still want to do the same thing, but they need guidance on what should be included in their programs based upon their individual needs. So when we look at the treatment of disease, so treatment of diseases has typically focused on curative efforts and lifespan extension, which we've seen over the years, and we'll talk about this later on, how lifespan has increased throughout the years. But a more palliative approach, which also emphasizes the treatment of the consequence of the disease, reflects a focus on quality of life. So exercise actually represents a palliative approach to disease treatment, but opportunities and access to training may be limited for special populations, leading to a low participation rate. In other words, what we're looking to do is make sure to expand access to this, because we know that, again, the physical benefits that exercise has, and it could have the same benefits to individuals who, maybe again would fall, like as I had said previously, would fall under these special populations based upon having a health condition or just something unique to their individual person, and they just don't know how or what to include in an exercise program to make sure that it's safe for them to participate in. And that's partially what you're going to be looking at in understanding doing this with special populations. So we look at the benefits of exercise in general, and again, this is stuff that's pretty well known, and we found through research and everything else. But regardless, these are so you have your disease reducing benefits. So what do we look with here? We look at things like reduction of body weight, decreases in blood pressure, improved lipid profiles, improved resting blood sugar levels. These are all things that can certainly enhance your life and enhance your lifestyle and either reduce the chances of getting disease, or if someone is in a situation where, say, they do have high blood pressure, they do have weight problems, where they could significantly impact their life by doing this. As far as improved body function, I mean, with exercise, and again, depending upon the type of exercise individuals participate in, and we'll talk about how really all forms of exercise are things that people should be participating in. But you have increased muscular strength and endurance. You have a reduction in the risk of falls in the older population. So one of the things that has been studied is looking at lower extremity strength and how individuals who do strengthening for their lower extremities, they tend to live longer because it decreases their chance of falls. Because we know that that's one of the things in the older population. There's a lot of issues related to falls and for instance, fracturing a hip and what that means for an older individual. Other benefits as far as improved function, improved mental health, and this actually includes reducing depression and anxiety with exercise. So there's psychological benefits to this. Improved physical work capacity. So what that basically means is, even if you think of your day-to-day physical activities, work around your house and things of that nature, it all becomes easier because of participating in exercise. And again, these benefits persist across age, gender, training status, current health, but the exercise program should be designed specifically enough to be safe and effective for each given the special population. And that's really what we're going to be looking at over the course of the semester, individuals who will have, again, various either pre-existing conditions or maybe predisposed to certain things based upon various personal factors, and how we can use exercise and what would be exercise recommendations for those persons, for that individual. Another thing that gets brought up a lot is, what's called metabolic syndrome, and metabolic syndrome is becoming something that is really kind of is a grouping of issues that basically puts someone at risk for various forms of disease. And metabolic syndrome is characterized by a couple different things. So there's basically 4 points to metabolic syndrome. One is being overweight or obese. 2 is having undesirable lipid profiles. 3, high blood pressure. And 4, high resting blood glucose levels. So those kind of basically bring about, again, what we call metabolic syndrome. And, again, all of this is associated, if you think of all of those things, they're all associated with a lack of physical activity. So we know that, again, many of the things that, health issues that kind of plague us do revolve around lack of physical activity. And obviously also nutrition as well. We're obviously focused more on the activity end of things in this course. So if we look at inactivity and causes, so again, only about 15 to 20% of adults above 18 exercise regularly, and this results in a greater incidence of chronic disease and increasing costs associated with healthcare. So, when we look at rising healthcare costs, a lot of this centers around, again, people having to be treated, for their life to, deal with many of these chronic diseases. Sedentary lifestyle is essentially the leading cause of preventable deaths. And, statistics of adults related to having a medical condition, many of these things could be prevented through physical activity. So, and again, we'll talk about inactivity arises from both individual and societal origins, and we'll talk about the difference between those two. Another thing I want to point out is that when you look at the 2008 physical activity guidelines for Americans, again, it's that 15 to 20%. They don't meet those basic guidelines, which we'll talk about later on in discussion. What some of those guidelines are. So societal causes of inactivity. So technological advances that reduce work. So we know that, with a lot of the technology, and again, technology is great. It makes life easier for us, but we have found that it does in general make us less physically active. If you think of a lot of the jobs and the work that people did, years and years ago, tended to require a lot more physical work. Well, technology, again, it's not to say technology is bad, but it certainly has reduced the amount of physical work that people do. And again, that kind of coincides with this. The shift in occupational duties require less physical exertion. And then another thing is just a change in community development to urban sprawl instead of smaller self-contained communities. So what that has basically done, again, not in and of itself a bad thing, but what it's done is it's reduced a lot of people from walking and maybe bicycling to places for daily transportation, again, has gotten people to, utilize cars more. Again, not bad in and of itself, but again, it has kind of caused us to just sort of naturally, change into just being less physically active. If you think of, again, people being more reliant upon automobiles to get to places instead of being able to, occasionally being able to walk, whether it's to a store or a shop or something like that, or even maybe even to work. That has obviously changed activity levels. So continuing looking at societal causes of inactivity, so you have an increase in the percentage of population over the age of 65. And again, these individuals are also usually less active. And one of the things we're going to talk about in this class is just talking about how, even older individuals, people over the age of 65, can still remain very physically active and do so in a safe manner, and what that could mean for just even their quality of life later on. And then just reduced outdoor play in public schools. So public schools maybe not having enough outdoor time, particularly for younger individuals. Reduction in physical education program and things of that nature. And again, that just requires, more private extracurricular programming to make sure that, younger individuals can remain active. So individual causes of inactivity. So now these kind of take on a different thing. So these are reasons that are, commonly reported by individuals for not being physically active, or again, what they perceive as reasons by. So again, perceived lack of time or convenience. One of the things we'll talk about is, I had mentioned the 2008 physical activity guidelines for Americans. If you look at those guidelines, they're really not giving, they're not time prohibitive. You'll see that again, we say, well, I don't have any time to exercise. Well, those guidelines, the basic minimum is not that much. People would be surprised that, they don't have to spend a ton of time being physically active. A little bit of something is better than doing nothing. But that's certainly a cause of inactivity. Lack of motivation or interest in exercising is another thing. Lack of personal management skills or support systems. So again, that could kind of come back to sort of what that perceived lack of time being related to. So managing your time and things like that. I mean, people are certainly busy, but there's very few people who really, you could flat out say don't have time to exercise, or at least get a minimal amount. Perceived lack of suitable resources, and then also limitations from physical disability or chronic disease. Again, all of these things can be managed in some way, shape, or form, and you as the individual, regardless what your role is as an exercise professional, there's some things that we're going to talk about that we could work with individuals around these things and hopefully get them to kind of be able to participate in some form of physical activity. So addressing inactivity in specialized populations. So, what we're going to be looking at, so the text that you have and what we're going to be, looking at throughout the semester is, we're going to be looking at different things that could help in dealing with special populations in an exercise setting. So we're going to be looking at the overview and pathology and pathophysiology of very common conditions. So we're going to be getting some background. Some of you, depending upon, what you're focusing on within the major, you may get even more extended education in pathology and pathophysiology, depending upon what you're studying. And then we're going to go through condition-specific recommendations for safe and effective exercise. So within each one of the chapters, we're going to be addressing and talking about, how could we implement, for instance, strength training to be safe for said population or said group of individuals, and how we can make it safe for them. Again, the Department of Health and Human Services. So it's been recommended, and I had mentioned this, the general recommendations for Americans as far as health. at least 2.5 hours of aerobic exercise weekly, or complete at least an hour and a half of vigorous aerobic exercise per week. So again, from a time commitment, that's not a whole lot of time. That's your bare minimum that you can start with. And then they recommend at least strength training at least 2 times per week. And again, strength training, and we'll talk throughout, people say, well, I don't have time to go to a gym. There's resources you can use, and there's so much information out there. And we'll talk about things if you get the person who, maybe can't go to the gym and they can't buy a ton of exercise equipment. Well, you're going to find out that, people don't need a ton of stuff. Just to get themselves started, there's some bare minimum things that they can have and do that can certainly be a benefit to them. So looking at scope of practice now, again, and we're going to talk about this more in class in regards to, because again, everybody's, sort of approaching this from a different perspective. Again, exercise professionals working with special populations are not licensed. So the scope of practice is determined by standards of care within the industry, and then earn certification. So we're going to talk about the special population certification a little bit within this, that an individual could go and earn if they would like to. But there's earned certifications, and the information that we're talking about in this class will help you if you so determine that you would like to, possibly get certified in training special populations. The National Strength and Conditioning Association has a credential that we're going to talk about in a little bit, the Certified Special Population Specialist, that you can also get, that would add a credential and show that you have requisite knowledge to create exercise programs for individuals who have these special concerns. So continuing on with this concept and looking at scope of practice. So the scope of practice for exercise professionals includes conducting health appraisals and physical assessments, as well as designing and supervising exercise training. So that's really what you look at. Now, again, depending upon some individuals, so for instance, in just looking at our programs, individuals who are looking at or involved in pre-athletic training and pre-physical therapy, those professions will obviously both get, as healthcare professions, will both get even, extended training. If you're somebody who's also, in addition to doing one of those, looking at getting some background in, exercise, additional background in exercise and fitness, that will kind of complement that. But it's important to note that, exercise professionals should not engage in activities presented as rehabilitation, treatment, or counseling. These activities should be referred to an appropriate licensed clinician. So individuals who are going to become, say, again, for instance, athletic trainers, physical therapists, those are licensed clinicians. So as a licensed clinician, as long as you're in your work setting, in addition to obviously doing the exercise stuff with that, you're able to say that you're treating them for, said condition. For the other exercise professionals, this is a point of emphasis that if you see something, you have to make sure, because what you're doing isn't considered rehab and treatment. What you're doing is something to just, again, enhance their life and maybe complement what they've done as a part of their rehabilitation and treatment. So that's a really important point to note as far as scope of practice. And again, individuals in our program here are kind of coming at this from all different angles. So I just want to make sure that we're all aware of, kind of where your scope of practice is going to be based upon your area of study. So again, excluded activities for exercise professionals. So again, if you're not a clinician like an athletic trainer or a physical therapist, so these would be things that those individuals would do as a part of their treatment that would not be included for the exercise professional. So you'd not be diagnosing conditions that limit function or cause pain. You wouldn't do things like direct soft tissue mobilization, gait training, neuromuscular education, counseling for disordered eating or body image. These would all be things specifically held for individuals who are licensed healthcare professionals in the various settings. So I will say that if you look on table 1.1, there's a list of conditions that we're going to be talking about. Again, we're doing this class to show how we can look at individuals who have these conditions and how we could enhance their life by giving them, again, exercise recommendations, work them through strength training programs, cardiovascular conditioning, what have you, and how to do that. From the exercise professional standpoint, you're not treating the illness or the injury or the condition. You're kind of giving them and working with them in their life to kind of enhance them through, general exercise. But certainly you have to keep in mind what their specific condition is. And again, table 1.1 does show the list of conditions, so you can take a look at that and see what we're going to be looking at over the course of the semester. So if you do choose, again, I had mentioned the certified special population specialist. Again, what you will do is use an individual approach to assess, motivate, educate, and train special population clients of all ages regarding their health and fitness needs in collaboration with healthcare professionals. So you'll be working with healthcare professionals to enhance their lifestyle. Now, again, some healthcare professionals do go and get further certification in this, and obviously then they would be able to kind of go from be able to do that as well. And again, you're looking to design exercise programs and help clients to safely achieve their goals. So it gives an exercise professional more extensive background in how to create safe programs for these individuals, because you'll get a background in the pathology of the various conditions, the common conditions that we're going to be talking about. So if we look at opportunities for individuals who get certified, you say, well, if I go and get the certification as an exercise professional, what does this mean for me? Well, again, nearly half of adults in the U.S. have at least one chronic medical condition. So think about that. And given the aging trend, this number is going to increase substantially because, again, as individuals get older, the chances of developing medical conditions does increase. Another thing is that, as lifespan increases, the skills practiced by, individuals who receive the certification are going to be necessary to address the quality of life issues and also help reduce the burden on the healthcare system. Remember, a lot of healthcare dollars are spent on, diseases and issues related to being sedentary. So we can kind of avoid that. And again, life expectancy has increased a lot, and in the reading it talks about this, but at one point, the life expectancy for males was 66 years old. That's all the way up now to 76 years of age. For females, it used to be a little over 71.7 years. They had it kind of averaged out. Now it's all the way up to just over 80 years of age for females. The problem, though, kind of, again, connected with that is we become less active. So we have people living longer, but they're less active, which means, again, they're more predisposed to a lot of these, diseases and things related to being sedentary. So again, this is more of an opportunity for individuals who are looking to do this. And again, since many patients are, will become unaccustomed to exercise as a therapeutic activity, medical referrals can be an important source of clientele for individuals receiving this certification. Okay. And that's important because many times, so say for instance, you have a patient who's getting discharged, say for instance, from physical rehabilitation, without time to really address the idea of then maintaining and doing some form of fitness routine. That's again where, the certified special population specialist could come in. They could kind of then take that person once they've finished their treatment and rehabilitation, and then kind of put together a plan for them to continue physical activity based around whatever, condition was kind of limiting them. So that's something that becomes very important and can certainly be a benefit to patients who are done with rehab. So one of the things that always does come up with individuals that fall under the special population category is a question of access. So what we're looking at, the idea here is the idea of inclusive fitness, which is an approach whereby special populations can train in the same settings as others instead of only in a medical or clinical setting. So that's the whole idea about inclusive fitness, and that means that these individuals don't have to be in necessarily a medical setting or a clinical setting or facility. They could go to all the same places that the rest of the population goes to exercise. And that's where there's certain considerations that have to be looked at these facilities in order to allow this to happen. And again, this approach emphasizes increasing physical work capacity and health promotion in order to increase independence. So the idea here is to make sure that these individuals can get out of a medical facility, and with individuals who are trained to work with them and have background to then be able to further enhance their physical health by doing that. So we look at the questions of access, we look at the Americans with Disabilities Act. And again, we're looking at, since the benefits of exercise apply to all populations should have access to safe and effective exercise training. So that gives us the Americans with Disabilities Act, which prohibits discrimination against persons with disabilities and requires reasonable accommodations to allow the pursuit of an active lifestyle in an integrated setting with other community members. So the ADA basically covers actually a lot of different settings. So again, the American with Disabilities Act covers the workplace, transportation facilities, various public accommodations and government activities. But the Act also addresses issues apparent in public and private settings for physical activities and exercise training. For instance, government institutions like county parks and larger recreation businesses, they're required by law to comply with the requirements of the ADA. Now, smaller individual recreational businesses, they're encouraged to comply to the extent that it doesn't cause financial hardship. So obviously, like, smaller private settings, it could, if it's a financial hardship, again, they're just basically encouraged to do the best they can. But a lot of the, public facilities and things like that, they all have to make sure that they're abiding by the American with Disabilities Act. So again, questions and access. So the ADA standards, looking at as of 2010. So since the American with Disabilities Act of 1990 has exceptions to enforcement, the ADA standards for accessible design of 2010 addresses specific structural requirements to ensure access to training facilities for all populations. Now, again, as I had stated earlier, these standards generally do not include smaller businesses. And again, part of that is because, it could cause financial hardship, but individuals are certainly individuals that, do run smaller businesses are certainly encouraged to try to abide by this as best you can. And in the end, it would make sense, if you can accommodate, you're obviously going to, just from a clientele perspective, open up the business to kind of helping more individuals. So some of the ADA standards 2010 requirements, usable doorway levers or automated doors or some of that. Here we have just how big the pathways should be, just to allow, for instance, for wheelchairs to be able to accommodate. So these are some of the standards. We're going to go through a couple more, but these are some things that, would be included within the Americans with Disabilities Act to allow these individuals to be able to further participate in many of these activities. So again, continuing on, 3 feet between all exercise stations with a 3 by 4 foot open floor space for a wheelchair to be parked without blocking a pathway. Again, this just enables individuals with wheelchairs to be able to, train and work out in these facilities. At least one available option for each type of training for each population, such as an arm ergometer for cardiovascular training. So for instance, if someone can't do cardiovascular training with their lower extremity, they would have to have at least one available option to do so. So having an upper body arm ergometer, which is basically like a bike for your upper body, where the individual holds on to the handles and cycles their arms through as they would, just the opposite of an exercise bike where you'd be doing it with your feet. Now you're just doing it with your upper extremity. So this would be an example. So trying to have at least one available option for somebody who, say wouldn't be able to use a certain type of machine or piece of exercise equipment. And again, other recommendations to increase access, again, increase staffing where necessary, and again, having individuals who are obviously, have background in kind of how to train individuals with that would fall into these special population categories. A mechanism to assist hand grasp on certain devices. So if a person has grasping issues, having lifting straps, or other mechanisms to allow independent mounting and use of exercise devices, or just having lifting straps so a person could grasp on or even grab, certain weights and things like that. Stabilizing straps if somebody has limited torso control because of the condition they have. These would be all recommendations that could be in place that, again, could just kind of help with that inclusive fitness and certainly allow individuals with special needs regarding their condition to be able to exercise in these different settings. So here's some other recommendations. Again, appropriately sized equipment for either obese individuals or children. So making sure that the different pieces of exercise equipment can be appropriately sized based upon the age and size of the individual. Seating for recovery in the training area if an individual would need appropriate recovery area. Again, reduce noise and visual distractions for individuals with cognitive issues such as Down syndrome or autism. So these are all things that you could be thinking about. Again, if you're looking to bring individuals in who would have these needs that can certainly benefit the population. And again, just adding to that idea of inclusive fitness and making it easier for them to kind of take on a physical activity, in a general setting, again, as opposed to a medical facility. So in conclusion, just to kind of wrap up, again, the benefits of exercise for all populations widely known, but again, we're looking at finding ways to make exercise easier for everybody in the population to do. And again, that should be obviously an aim because it could, again, the benefits are the same for everybody. And we know that, if someone does have a known condition, in all likelihood, there's something that exercise could do for them, whether it's physical, mental, whatever it may be. It could certainly be a benefit. Okay, again, special populations include those with specific conditions, and again, requiring training recommendations that differ from the general population. And we'll see that, again, you'll even see as you go through, even with some like specific conditions that we're going to be talking about, there could be circumstances where what they can do can be, what they could do compared to the general population could still be safe. Again, but we're going to look at the exceptions to that and where those considerations need to take place. The certified population specialists have specialized knowledge to train these populations safely and effectively, including how to carry out training in an inclusive manner. Again, the key here being that, again, you're not looking to treat a problem, okay? So again, unless you're a licensed in addition to that, if you are a licensed healthcare professional and for the setting it works for you, you could then do that. But it's just important to know that your role in the exercise as an exercise professional is just to help them train safely and effectively. You're not there to diagnose them. You're not there to directly treat their condition. It could certainly help them improve their condition, but you're not directly looking to treat them. And again, establishing a good relationship with other medical professionals. And this is what, as an exercise professional, what you can do, if you're working in a setting, obviously, establishing a good relationship with medical professionals can also make, things like referrals and that much more likely. So that's another thing you'd want to look at, and working with them, directly can certainly help with that. So these are your learning outcomes. And again, I'm always going to post learning outcomes at the end of every discussion. Again, the learning outcomes can just help you organize your studying. So look at these learning outcomes as kind of your, your review for your exams and any types of quizzes that we would have. And these are the rest of the learning outcomes.